Right. Good evening, everyone. As there's a medicine lecture going on, the people who are will be joined to the lecture will be little later, or maybe the people who are uh, there at the medicine lecture can hear our record version. So anyway, we'll start. Otherwise, we have to delay this. So. Uh, that's not nice as there are several people who joined the live session. So we'll do it now, and the people who already registered, they can listen to the lecture, the record version later, right? Okay, so this is what we are going to do. This is the first day, and as the first day, we are just giving you seven true false questions and seven single best answer questions. So you can switch on your cameras and you can do this live here. I'm not going to ask questions from anyone. So what we are going to do is we are going to give you seven questions, seven mm, uh, seven true false questions and seven SBA questions. So uh, you have 28 minutes. That means roughly 30 minutes. You can do at now within 30 minutes. Then you can we will discuss. The people who are listening to the record version, you time by yourself and you do it according to that 30 minutes. So that is more productive than doing it uh, without by taking a lengthy amount of time. So rather than that, you do it within 20 minutes, 28 minutes, roughly 30 minutes, then we'll discuss, right? So uh, otherwise, the people who came to the live session, that's not nice. We are waiting till they finish the medicine lecture. Okay, so this is the first true and false questions. So here there are two, so you will get 4 minutes. After that, I'm going to the next questions, right? So start now. Right. Shall we go to the next one? Navid, do you need more time for the first question? No?
So can you give me 2 more minutes?
Okay. Okay. Now I think finish 4 minutes. So the third question, you have 2 minutes. Right. We are going to the next one. Okay. 2 minutes. Okay. Right. So I'm moving to the last question. Right. Time's up for the true false one. So let's move into the single best answer questions. You have 15 minutes again, same as the previous one. Right. Okay, let's start. So the first question, you have 2 minutes. Can you see the screen or you want me to zoom it? Navi? Okay. Two minutes. You're right. So next question. Start. Two minutes gone. So let's move to the next question. Right. Right. Start. Right, let's go to the next one. You have easy questions now. Few easy questions. So I'll give you 3 minutes for two questions. You have to do this quickly. Okay, so 6 question. 2 minutes. Okay, let's move to the last question. Easy one. Right. So Uh, I hope you guys finished this. So let's discuss the answers for the questions. So the people who are listening to our record version, they can send text messages through WhatsApp if they have any questions. As people are listening to the medical medicine lecture, so the people who can listen to this later. Right. So we'll discuss. So you can see the screen, right? Okay. Which of the following is are true or false regarding drug impaired driving according to the Motor Traffic Act new regulation 2025? So these are the type of questions where you are going to get in your exam. So these are modern questions. These are some practical questions. So you don't get those ordinary questions like what is death, what happened after death, what happened with the post-mortem rigor mortis. So those kind of questions are no more there. So they are giving this kind of practical questions, lengthy questions. So you have to read these questions, and if you have that much of level of knowledge, you can answer these questions well. So you all know that under forensic aspect of alcohol, we discuss about the Motor Traffic Act. In that Motor Traffic Act, there's a latest amendment to this uh, then Motor Traffic Act. There was some uh, kind of uh, okay amendment to this, which called the 2025 amendment. So uh, and all the students who came to our classes, they got all the similar questions for their exams, and also this one, uh, this questions are much more similar, sometimes much more advanced than the real exam questions. So then you will be very easy when you are going to the exam, because as you all know that the exam questions are much more updated, practical, and new and modern type of questions. So these questions are similar to those questions. So our questions are much more similar. And the previous time there are more than 15 questions exactly similar to our questions, right? So I'm going to quickly give the answer. If you are willing to give answer, Navid, you can give the answer. Others are coming and going. So you can, if you are willing to answer, you can answer. The people who are listening to our record version can send their questions later, right? Okay. A police officer can produce any suspicious driver to a government medical officer for examination with his own reasonable suspicions of driver's clothing indicating drug use. True or false? What do you think now?
But that I think false.
This is true, Navid. So what you have to do is you have to go to the motor traffic amendment. That is, you can simply download it. There's a it you can find it in the Google, and you can search in the Google and find out the motor traffic amendment new regulation. So in that, they have mentioned that the amendment. So we are also going to discuss about a lecture which related to the motor traffic act amendment in near future for the upcoming exam. So where we are going to discuss about the motor traffic act and what has happened to the amendment, the recent amendment. So they are in that amendment in September 2025, they mentioned that police officer can suspect the speech, action, movements, balance, eye, clothing, and so that kind of suspicious are there. With that suspicious, police officer can produce for a government officers for a medical examination. So this is true, right? Police officer can produce any suspicious driver to government medical officer examination with his reasonable suspicion of driver's clothing. Yes, police එක්කනට මෙයාගේ ඇඳුම් ඇඳලා ඉන්න විදිහෙන් drug use කරලා කියලා අල්ලගෙන යන්න පුළුවන්. Yes, that's true, right? So that is in the new amendment. Blood samples are easiest and most reliable, most legally acceptable for drug testing of a suspect of a driving vehicle after consuming narcotics. What do you think? B.
B is true.
B is true if they give easiest and most legally acceptable. If they give most legally acceptable only, yes, that's true. Easiest, blood taking blood is not easiest. It's a kind of invasive procedure. None is invasive. One is the urine test, where most of the times we doctors are doing these days the urine test. If you go to the news that there are the National Transport Board these days recently go to those bus stands and they do the multi-drug screening urine test. So this the most legally acceptable, we can say it's blood, but the easiest one is not blood for drug testing. The easiest one is multi-drug urine test, right? Okay. If a police officer suspect of a driver of a vehicle using drugs and driving, that police officer has the authority to perform saliva test, which can be done at the roadside or police station. What do you think? Are they doing saliva test? Just go through the amendment and the Motor Traffic Act. They mention that now in addition to the breathalyzer, they can use the saliva test, which they can done at roadside or either police station, right? Breathalyzer, they can use the breathalyzer, also saliva test, right? D. A police officer can suspect a driver use drugs and driving while the vehicle by suspecting the driver's eye appearance and can request the driver directly for the clinical examination by JMO. What do you think? As I mentioned, that is true because according to the amendment, police officer can suspect according to the speech, action, movements, balance, eye opening, clothing. So everything includes, so the eye appearance can request the driver directly for clinical examination by JMO, right? So driver always have the authority to refuse to provide necessary samples for examination. What do you think, Navi? So that's an easy question.
That's false.
Driver always have the authority. Yes, driver can refuse. Urine sample දෙන්න කියනවා බෑ. breathalyzer පිමින්න කියනවා බෑ. සැලයිව දෙන්න කියනවත් බෑ. So what will happen? These refusals have legal consequences. If you refuse everything, you are, according to Motor Traffic Act, they mention that you are eventually uh, marked as under influence, right? If you are a suspect, you are refusing everything. Eventually, uh, you are taken as a person who consumed that suspected narcotic, right? So driver always have the authority to refuse. Yes, that's true. Refuse කරන්න පුළුවන් හැබැයි there's a consequences, right? Okay, next one. Which of the following is are true false regarding chronic effect of drug abuse? So they are asking about the chronic effect, not the acute effect, right? Heroin causes dependent and withdrawal symptoms. True or false? Easy. What do you think? Naveed?
That's true.
Yes, that's true. Usually, yes, right? I am asking from Naveed because your name is the one who always appear in the first one, and the others are coming and they are leaving, right? So, uh, is it okay if I ask that kind of question? You are not uncomfortable, right?
Uh, 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 so you can ask, yeah. So
Yeah, right. Okay. Cocaine can cause nasal septum perforation. True or false? Yes. Why? Cocaine is a potent vasoconstrictor. You know that the taking cocaine is a method is snorting and keeping in the nasal septum and absorb it, right? So that chronic uh, use can cause nasal septal vasoconstriction that can cause nasal septum perforation in chronic as a chronic effect. Yes, that's true. Chronic cannabis use is associated with amotivational syndrome. What is amotivational syndrome? You Google it. It's a chronic psychiatric condition where lack of motivation, apathy, and disinterest. Yes, that's a complication of chronic cannabis use, right? So they are not going to ask easy question like how we are going to get cannabis by smoking. So those are ordinary questions years before they ask. Now they are asking these type of questions, right? Dental decay is a complication of chronic methamphetamine use. True or false?
false.
If you Google a thing called meth mouth, right? It's called meth mouth. It's a kind of lifestyle plus psychological condition where severe dryness, because this is a sympathomimetic, this is a CNS stimulant which causing severe dryness of the mouth and prolonged clenching of the frequent clenching of the teeth can fracture, and the poor hygiene of the teeth and severe thirst. People use more carbonated water. Because of that, dental decay is a complication of chronic methamphetamine use. Yes, that's true. Okay. E. Suicidal tendency decreases with long-term cannabis use. Easy. Now, what do you think?
False.
Suicidal tendency is decrease. That is false. That is increase. Yes, you are correct. Okay, next one. Which of the following is are true or false under new amendment of the Motor Traffic Act? As I mentioned, you have to read the amendment. Seat belts are mandatory for all passengers in expressways. If you go through the news these days, you can answer this question. What do you think?
That's true.
Yes, that's true. When it comes to highways, they mention that no person shall drive a vehicle in a highway after consuming alcohol or narcotic. That is mainly that is mentioned as highway. So this is seat belts for expressway. Expressway means what we are mentioning as highway is the expressway. What is mentioned in that as highway means these ordinary roads, right? So when it comes to the Motor Traffic Act regarding the drunken driving and the alcohol narcotic consumption, they mention as no person shall drive a vehicle in a highway, right? So highway mean that is ordinary roads. They specifically mention as expressway means this what we call highways, right? Okay. So seat belts are mandatory. Yes, according to this amendment, that's correct. A police officer suspect that a driver used a drug while driving can immediately produce to a government medical officer for clinical examination without any prior testing under new regulation. We discussed this earlier. Do they want to do saliva or breathalyzer before they produce to a doctor? Maybe you have a doubt. So yes, this is true. They directly they mean think that this person consumed cocaine, this person consumed heroin. They don't want to do any breathalyzer or saliva test. They can directly go for a JMO or a whatever Dr. DMO or whatever MOPD or whatever doctor they in their police area, right? See, refusal to undergo drug testing has no consequences according to the new amendment. I mentioned that is false. There are consequences. You can refuse, but there are consequences. D. A police officer can request to perform breathalyzer test of a driver with suspicious abnormal speech of a driver. Easy. You don't need any knowledge to answer this. What about Naveen?
That's true.
Yes, true. කතා කරන විදිහ අවුල් කියලා they can ask you to perform the breathalyzer. Yes, that's true. JMO only provides the final report after lab confirmation. That is false. JMO won't don't wait. Sometimes they send the final report by saying the lab confirmation will come. So we send sample for the government analysis. Some reports are pending, and our clinical finding is this. So that's kind of reports are we are sending. Only provides the final report after lab confirmation. That is false. Sometimes we send the final report with mention that lab reports are pending, right? Okay, let's go to the next one. 4. Which of the following is true or false regarding intern medical officer's duties related to the information of hospital police post, right? Or what do you think? You can answer this question. Delay in informing the police can be considered as a medical negligence against an intern medical officer. True or false, Navi?
That I don't know.
Uh, let's say there's a person, you are a intern medical officer and a pediatric or genetics ward. There's a person admitted with immediate sexual assault, rape by an unknown person. So you are that the patient is saying that that was happened or 2 hours before. So what you are doing is you are not informing it to either for your seniors or whatever the police or whatever any other relevant particular officers. Uh, you are delaying it for 24 hours. Next day morning, your consultant and your seniors get to know that you have delayed this intentionally for 12 hours, 14 hours. So that can be a medical negligence. Yes, that's true, right? Intern medical officers can directly inform the police regarding any suspicious medical legal case. True or false?
That's true.
Yes, that's true. You can inform the police. You have to inform the police regarding this is suspicious. This. You don't need to wait till your consultant comes. Right? Informing the police post must be documented in the bed ticket by the intern medical officers. Easy. Yes, you have to inform the police. Inform JMO, inform police. You are documenting those under your management, right? Inform කරන එක මිස් කෙනෙක්ගේ කාගේ හරි වැඩක්, but you are documenting that properly in the BST, right? The intern medical officer should inform the consultant, and only consultants are allowed to inform the police regarding any suspicious medical legal case. We discussed that. That is false. That's not only by consultant. You can, right? All poisoning cases, including self-ingestion of poisons, should be reported to the police post. True or false? Self-ingestion.
That's true.
That's true, yes. Even though it's a self-ingestion, you have to inform. 5. True or false? Which of the following is true or false regarding proper documentation as an intern medical officer?
Excuse me,
And
sir.
yeah,
Sir, in the fourth one, first one, like, is it true or false?
which one?
Fourth question, A.
A. This is true. Can be considered as a medical negligence. Yes, as I mentioned, kind of you are intentionally delaying a rape to inform the police, inform JMO, right? So as you are delaying, it can be 12 hours delay. There can be delay in taking samples from by JMO, so that can cause mm, loss of evidence. Patient can bath within that 12 hours. So that can consider as a medical negligence, right? Number 5, easy. Which of the following true or false regarding proper documentation as an intern medical officer? An intern medical officer should only use the ink pen provided by the hospital to document in the bed ticket.
False.
Why? Yeah, false. Yeah, ink pen. You have to use an ink pen, but or not always from the hospital. You have to find sometimes by your own, right? And intern medical, but you can't use a pencil. Okay, you can't document by using a pencil. An intern medical officer can use pencils for documentation in the bed ticket. If the ink pens are not available, that's false, right? And you can use the red pen as a doctor. Red pens used by the nurses. Then corrections can be made by removing the relevant page of the bed ticket. True or false? Never ever, you can't remove a page of a bed ticket, right? That's illegal. Retrospective documentation regarding a procedure after finishing the procedure is considered as an offense. What do you think? You are doing a procedure, then you are documenting it as a retrospective writing.
So what is retrospective documentation means?
Retrospective documentation means you are doing a procedure, you finish the procedure, and you go and document it. Retrospective writing. At this time, I did this. Is that offense considered as an offense?
That's false.
Why?
Because it is not an offense.
Yeah, yeah, why? How? It's not always. So let's say an emergency. You can't write, I'm going to tube the patient, I'm going to do the giving adrenaline. So you are not documenting it. You do the management, tube the patient, give adrenaline, CPR. After that, you are retrospectively writing, right? So not always this is right, but you can't do like without the patient consent. You did something and mentioning that I did this, so that is wrong. But retrospective documentation regarding a procedure after finishing the procedure is considered as an offense. That is false, right? It's not an offense. You can write. Example, when you are in an emergency, right? Clear handwriting always increases the evidential value when the bedhead ticket is used as the evidence in court trials.
That's true.
That's true. Always increase. Yes, clear handwriting always increase. 6. Which of the following is true or false regarding forensic aspect of narcotic abuse in Sri Lanka? Blood and urine are most commonly used samples for toxicological analysis. True or false?
That's true.
Yes, that's true. Urine is the most common, then blood, right? Anyway, this was other way, blood and urine. Anyway, are the most common, both. Yes. Hair analysis can detect chronic drug use. Yes, that's true. Sometimes you can. That's the ectodermal tissues. I think they are selectively deposit some toxicological samples, selectively deposit in these kind of hair. So hair follicles, you can take hair follicles and analyze the chronic deposition, right? Doubt in maintaining the chain of custody can be considered as a medical negligence of an intern medical officer. True or false? Chain of custody maintaining. What is that? You are taking a sample, you are giving that sample to your attendant, go to the lab, get the report and come back. So you are sending your person to either lab or sometimes we are sending to the government analysis. So maintaining that proper chain of custody, labeling, sealing, sending with the well reputed, official person. So that is considered as a doubt in maintaining. ඔයා මම දුන්න මේක මේ පේෂන්ගේ එක්කෙනෙක්ට යාළුවෙක්ට තමා දුන්නේ. එයා තමා ගෙනියව්වේ. You are saying that kind of thing to the police or the courts. So that is considered as a medical negligence. Yes, that's true. Doubt in maintaining the chain of custody. Okay. D. Visual examination alone confirms narcotic use. True or false? Visual examination alone confirms narcotic use.
False.
That's false. Visual examination, you can suspicious. That's why the new amendment says the police officer can visual examination and suspicious and go to a doctor and check the narcotic use, but not like confirms. It's suspicious. Postmortem toxicological samples are not reliable in determining cause of death related to overdose as enzyme activity does not cease immediately after death. What do you think? Not reliable.
False.
Yeah, it's like this. A person, let's say you are suspecting a person dead with heroin overdose. So what you are doing is you are taking post-mortem blood sample and sending to the government analysis, and they are sending back you as say mentioning that there are heroin up to this level. So anyway, once immediately after death, you know that there's a mm, somatic death and the cellular death, even though the uh, body death of the whole body confirmed the cells still not dead or if they are working in a minimal maintained level. So the enzyme activity also there for a given period of time. So because of that, there can be changes in the blood whatever the sample, there can be changes even after the somatic death, right? So because of that, postmortem toxicological samples not reliable, that is false. We always taking postmortem samples and sending, and we are taking those as this and saying that this one positive, this one negative, this is overdose. You can say those things, right? So the postmortem toxicological samples are not reliable, that is false. Those are reliable, right? Okay, last one. Which of the following is are true or false regarding road traffic accidents? Chest injuries are commoner in front seat passengers than in the driver of a same vehicle. True or false? You know those things. Naveed,
False.
why?
Because of the steering wheel.
Yeah, because of the steering wheel, chest injuries are more common in driver than front seat passenger of the same vehicle, right? Reckless driving and death of a pedestrian can result a criminal charge. True or false?
That's true.
That's true because Motor Traffic Act and Rash and Negligent Act that shows that gives the rash and negligent manner driving, which goes into criminal charge, right? Yes, that's true. All road traffic accidents must inform the police by an intern medical officer, even without the consent of the patient.
That's true.
That's true. You have to mention. Even the patient says, අනේ ඩොක්ටර් කියන්න එපා මේ බල්ලෙක් කැපිලා වැටුනේ. So you can't send the patient without uh, giving that information to the uh, police post. Otherwise, you will be in a later. You have to go to the courts and tell that this thing happened. This was sent because of this, like that. We don't know what has happened, exactly what has happened. So even though patient is refusing, you have to mention the patient that we are in a position that we have to inform this to the police first, and you have to inform, right? A restrained driver is more vulnerable to head injuries than an unrestrained front seat passenger. True or false?
False.
Restrained driver means seatbelt දාලා ඉන්නේ more vulnerable for head injuries than unrestrained front seat passenger. Seat belt දාලා නැති front seat passenger එක්කෙනෙක්ගේද head එක වදින්න පුළුවන් seat belt දාලා ඉන්න driver usually they are the head injuries are less compared to the front seat passenger because as you mentioned the steering wheel. Chest injuries are more common in front seat driver. Head injuries are more common in front seat passenger, right? No compensation is payable if injury is due to willful disobedience of the safety rules according to the Workman Compensation Act. True or false? If you go to the Workman Compensation Act, they mention that when you are coming for the work, when you are working, when you are going after work, you are eligible to get compensation according to the Compensation Act, right? Workman Compensation Act. එතකොට ගෙදර යනකොට no compensation is payable if injury is due to willful disobedience of the safety rule. කල ලයිට් එකේ රෙඩ් ලයිට් එකෙන් පැනලා යනවා වැඩ ඉවරලා. ගිහිල්ලා හැප්පුණාම වැඩ ඉවරලා යන මිනිහෙක්ට දෙන compensation එක දෙන්න පුළුවන්. No, you can't. No compensation is payable if the injury is due to willful disobedience of safety rules. Yes, that's true. Right, so that's how these questions are there. You have to answer those type of questions. Those are the type of questions you are getting in your exam. So that's the exam level. So we'll discuss quickly the SBA questions. Right, so these are the same questions you If you go to the exam, last time exam, these type of same questions are there, right? You are an intern at a surgical unit. On your busy on call night, a male patient was brought to your ward by unknown people who said that he was inside a vehicle at a scene where two vehicles had collided. Your clinical examination of the patient shows GCS 8, BP 110 by 80. You perform the initial management. Later, you are doing the injury documentation of the patient, which injury pattern is most relevant injury pattern, which gives you an idea about the patient was driver of a collision vehicle, as I mentioned. Now you can understand what are those injuries. Driver of a vehicle can get chest injuries, hand injuries, and pedal related. The pedals, he's keeping his both legs in brake or clutch and the brake when the impact is happened, so he can get usually the lower limb injuries, steering wheel tightly gripped by the both hands, so you can get upper limb injuries. And if he hits rather than the head injuries, you can get chest injuries. So what are those injuries? Bilateral knee joint abrasions. Bilateral knee joint abrasions එන්න පුළුවන්, but unlikely. Forehead lacerations, as we mentioned, forehead lacerations are not common in front seat, driver. Those are head injuries are more common in front seat passenger. Left side clavicle fracture. So let's say in Sri Lanka, when you are driving, seat belt is coming from the right side to the left of the driver, then the front seat passenger, it's the other way, right? So then uh, clavicle fracture means it's a seat belt related injury. So the left clavicle is usually affect in the front seat passenger. Right clavicle is usually affect with the driver, right? So go to those points where the right side clavicle fracture, right? So this is how you are going to find out the driver. Then bilateral knee joint abrasions එන්නත් පුළුවන් නැති වෙන්නත් පුළුවන්. Bilateral ankle joint dislocation, yes, that is more common in driver. Left side clavicle fracture, again left side mean he's the front seat passenger. Next one, bilateral ankle joint dislocation, yes, left side clavicle fracture. Wrong. Anterior rib fracture, anterior rib fractures common in driver, right? Bilateral ankle joint dislocation, right side clavicle fracture, anterior rib fracture. Yes, all these three are correct. Bilateral ankle joint dislocation, left side clavicle fracture, that is wrong. Forehead laceration, again wrong. So the answer is answer D. Bilateral ankle joint dislocation, right side clavicle fracture, and the anterior rib fracture. Why? Bilateral ankle joint dislocation because of the pedals, right side clavicle fracture because of the seat belt, anterior rib fractures because of the steering wheel, right? So that is the answer. Answer is answer D. 2. You are an intern at a surgical unit on your busy on-call night. An unconscious patient was brought to your ward by unknown people who said they found this person beside a road. Injury examination shows following injuries. Fresh graze abrasion on both palms, left side collis fracture, fresh graze abrasions on both knee joints, right? Deep, fresh 5 centimeter laceration of the chin, base of the skull fracture in the middle of the middle cranial fossa. According to your injury construction knowledge, based on the above findings, what is the most suitable scenario? Describe how the above injury happened. Punch on the front of the face and fallen on ground. A driver of a car with frontal collision with another vehicle, head impacted on the windscreen. A passenger of a bus fell down by the bus while trying to get into a moving bus. A pedestrian, while crossing the road, was knocked down by a car at a slow speed and side of the head impact on the ground. A motorbike rider without a helmet is going on high speed forward projection following a sudden impact. What do you think, Navid? Easy.
So I think the answer is The answer is D.
Answer D or E? You mean
The answer
D?
D. D. Yeah, D.
D. Right. So when it come to pedestrian while crossing the road was knocked down by a car. That means car in a slow speed. So head impacted on the ground. So when the vehicle as a pedestrian injuries are usually found around the knee joint. So that is the tibial fractures and those we mentioned those things that the primary impact side is the around knee joint. So you get tibial plateau fractures or uh, distal femoral fractures, right? Then they can fallen on the ground. Yes, they can keep the hand and they can get collis fractures. Right. When punch the front of the face and fallen down, so that is unlikely because these grace abrasions of the both palms and grace abrasions of the knee joint means this is not just fallen on ground. This is a kind of moving force is there rather than just fallen on ground. There's a kind of moving, right? So when the moving is there, mm, this drive of a car of a frontal collision, it is unlikely because these are not the correct pattern of the drive of a vehicle, right? And the passenger of the bus fallen usually is fallen on backward, right? Not forward. While trying to get in, you are usually fallen on backward, right? The pedestrian while crossing the road, the primary impact site is usually around the knee joint. You get lower distal femoral fracture or upper tibial fracture. Then can be fallen on the ground. You can get knee joint abrasions. You can get palm abrasions, collis fractures, but they specifically mention slow speed. Uh, so because of that, there can be unlikely to have a chin laceration and uh, cranial fossa fracture. So if this pedestrian answer D is mentioned as high speed, so then your answer can be much more tally with the answer E. So this motorbike rider, while without a helmet, is going on a high speed and forward projection. හැප්පුණා විසුණා අත් දෙක තිබ්බ කකුල් දෙක හිරුණා මේක වැදුණා chin laceration එක ආවා collis fracture එක ආවා base of the skull fracture, right? So the most reliable answer is a motorbike rider without helmet is going on a high speed forward projection following sudden impact, right? So the usually the base of the skull fracture with the middle cranial fossa, you get hinge fractures because of this chin laceration, the force transmitted to there. So that happens when somebody is fallen down with the high speed and hit the chin, right? Okay. Next one. You are an intern medical officer at a pediatric ward. A 14 years old girl comes to your ward with her stepmother following a history of falls. You suspect there is a child abuse as you suspect the injuries are inconsistent with the history. You start taking the necessary steps according to the national guidelines. Suddenly, the stepmother comes to you and shout that both child and stepmother want to leave. There is no need of further actions. What is your next most correct legal and ethical action you are taking as an intern medical officer of the ward? Ask the stepmother to calm down and lock the ward with the help of the other staff as stepmother and child cannot be missing from the ward. Inform the police or probation officer regarding the situation and discharge the child. Ask the stepmother to bring the child's father once he arrives. Discharge the child after discussing with both the father and the stepmother. Ask the stepmother to calm down and inform the police post to issue a medical legal examination form to the mother's behavior. Ask the stepmother to calm down and inform her that child should be discharged after medical legal management is finished. Now in easy answer, only one.
So I think it's the last one.
Yeah, it's the last one. You can't do any other thing. So this is if you go through the uh, previous exam OSCE, this same question they have given and asked what are your next management. So we discussed this same question in our mock OSCE as well. As a part of the our mock OSCE, we discussed this. So this is what you can do is you ask to calm down and you are discussing with the mother as that we can't discharge this as there's a medical legal management is going on, right? Right. So next one, easy. A doctor refused to sign a false medical certificate requested by a colleague. This action demonstrate which ethical principle? Autonomy, justice, veracity, beneficence, null maleficence. What is Navi?
So I think it is autonomy.
Right. Autonomy means patience, authority to take decisions. Justice means equity and equally treated for all patients without discrimination of their gender, age, race, whatever the skin color, whatever, right? Veracity means truthfulness. Beneficence, do good to patient. Non-maleficence, do no harm to patient. So what is that? Refusing to sign a false medical certificate is veracity, that is truthfulness, right? Answer C. 5. A doctor may disclose patient's information without consent in which of the following circumstances? When requested by the patient's relatives, when the employer asks for a medical report, when court ordered by the court of law, when the media requested, when the medical colleagues ask out of concern. Which one is the answer? Easy. Any answer, Naveen?
So the answer is C.
Yes, answer is C. If the court of law asks, you have to send a MLR, medical legal examination, MLEF, MLR, whatever, or you have to appear in the courts and say the things about the patient without the patient's consent, right? All the other things you need the consent from the patient, right? 6. You are an intern surgical officer in Badul Hospital. On your busy on-call night, almost 35 people were brought to the ward after bus fell from a hill. Your brief overview, there are several elderly people with multiple limb wounds, GCS 15 out of 15, a few children with multiple wounds, GCS 15, few dead bodies, GCS 3, few adults with bleeding wounds on the right side of the chest and grasping type of respiration. Several people, including media and media people, arrived outside the ward trying to enter the ward. What are your best approach in managing this emergency? So call for help for co-HOs, ask security to chase away outsiders and start treating children first. Call for help for HOs, ask security to chase away the outsiders, triage the patient and start treating children first. Call for help from the ward staff categories, ask security to chase away the outsiders, triage the patient and start treating the adult with grasping respiration first. Call for help for the ward staff categories, request outsiders to calm down, triage the patient and start treating adult with grasping first. Call for help for the ward staff categories, request outsiders to calm down, triage the patient, and start treating elderly people with multiple limb wound first. What is the answer? Now it easy. If you
So I think the answer is D.
answer D, yes. You are not chase away the outsiders, so that is wrong. If you have that kind of one, you can remove all this. You are not never going to do these type of things, right? And GCS 15 out of 15, even though the children's they are multiple wounds, they are GCS 15. They are GCS 15. Uh, there are a few adults bleeding wounds, right type the chest with grasping of respiration. So those are the people you have to immediately attend, right? So that should be there. Adult with grasping respiration first, right? So answer is D, call for help, request outsider to calm down. Here, request to chase security to chase away. That is wrong. So the answer is answer D. So that's how you are going to answer. So that's a kind of pattern, type of a pattern of these single best answer type questions where they are going to ask these kind of lengthy questions, but you have to remove one by one. There's a point which wrong point, so you can remove some quickly. You can remove all those wrong answers. Then you can come to the correct answer easily, right? So even though those are lengthy, those are easy, right? You are an intern at a surgical ward. Your co-HO consuming alcohol sometimes within the duty hours and come to work. You feel reluctant to report because you two are good friends. Which ethical principle should you respect to the most of these? Autonomy of the patient, beneficence, professional courtesy, non-maleficence, privacy of the colleague. What do you think now? Last question.
So I think the answer is professional courtesy.
Right. So autonomy of the patient means patient has the right to decide what he's going to do. I'm going to do this surgery or not or whatever, even though it's beneficence, even though it's life saving, patient can decide. Autonomy means that. Beneficence mean you can do good. Patient, you if you have a ICU bed, if the patient is need that ICU bed immediately, you are sending your patient immediately to the ICU. So that is mean beneficence, do good. Professional courtesy, you have a professional courtesy towards patient and the staff, right? Uh, but professional courtesy cannot be there towards you but professional courtesy should be benefits to your patients ultimately, right? So, what is non-maleficent? Do no harm, right? Do no harm to your patients. Privacy of the colleague, you have to respect your privacy of the colleagues, but there should be a non-maleficence. Do no harm to your patients, right? You have to respect your colleagues' privacy, but colleague privacy එක රකින්නවා කියලා alcohol වැඩ කරන වෙලාවේ බිලින්න බෑ. So that is wrong, right? So if you are uh, if you are not reluctant to report this, if you are not reporting this, you are doing harm to your patient. So that is means maleficence, not non-maleficence. Non-maleficence means do no harm, but maleficence means do harm because you are not reporting this, right? So from these answers, the best one you have to take as non-maleficence, do no harm. This ethical principle is breach here, right? Okay, professional courtesy is yes, correct, but out of professional courtesy and non-maleficence, this is the most reasonable ethical principle you should practice here. Do no harm, right? Okay, now it's so why I ask from you is you are the one who is always appear here, and the people sometimes come and go, and the people who are listening to our uh, record version, they can send their messages to our WhatsApp number. And next week onwards, we are planning to discuss 15 questions each. Um, or maybe if they requested, we are going to do this again as a another lecture. We'll see. That depends with their requirement. Anyway, we'll see. So hope all guys understand. If you have any questions, you can send to our uh, WhatsApp number, right? Okay, Navid, do you have any questions? No? Okay, right.
Yes.
Right. Then thank you. Good night. Thanks for listening.